Welcome everybody. I wanted to thank y'all for being here this evening. My name is Claudia Lennhoff and I'm the Executive Director of the Champaign County Healthcare Consumers. And I want to tell you a little bit about our organization and then about tonight's meeting and then we'll get started. I apologize, I need a set of agendas. Okay. So first, about Champaign County Healthcare Consumers. We are a nonprofit, a 501c3 organization. We were established in 1977, so we've been here for over 40 years. We do advocacy, but we also, and organizing, but we also do direct client services. So a lot of our time with client services is spent helping people get health insurance or get the health care they need or prescriptions they need and other kinds of resources. And we provide our services for free to community members. And the staff we have now are individuals who have been doing health insurance enrollments through the marketplace and Medicaid since the Affordable Care Act really opened up the marketplace and expanded Medicaid. So the folks you'll be hearing from tonight are some of the foremost experts in our community in this work. Okay, the purpose of tonight's meeting is to help everybody get ready for the ACA Marketplace open enrollment and also Medicaid. The state of Illinois expanded Medicaid, and a lot of times people don't know which program they qualify for. That's what we're here to help with. But so we'll be presenting information to help everybody get ready for open enrollment. Just a few housekeeping items. If you have cell phones, if you don't mind turning off the ringer, please. And we have refreshments at the back. You should feel free to get up and help yourself at any time. And then the restrooms are out the door and to the right. Okay, how we'll be running the meeting this evening. If you've been to our meetings before, you know that we always have an agenda. We follow the agenda, so you know exactly, what we'll be talking about at every stage of the meeting. So everybody should have an agenda, and then behind your agenda, you have a green handout that we'll talk about later, but it kind of explains the difference of who can apply through the marketplace based on income versus who should apply for Medicaid. And then you have a handout that gives you a glossary of terms because health insurance is complicated and there's different terms that you'll be hearing about. And then you have this nice little double-sided handout which is to help you get ready for signing up for insurance through the marketplace. And then lastly, we have this little handout that is a plug. We're asking you, if you don't mind and if you have time, to please go and fill out a survey. We're trying to survey people who have been coming to us for help with health insurance, and we sort of want to see what things are working well, what needs to change, and so on. Okay, so that's the agenda, and that's how we'll be proceeding through the meeting. The co-sponsors for tonight's meeting are the Barham Benefit Group, Carl Christie Clinic, OSF, Heart of Mary Medical Center, Health Alliance Medical Plans, Cunningham Township, and Promise Healthcare, which operates Francis Nelson Health Center and Smile Healthy Dental Program. Okay, now we're going to get started. So, I just wanted to start by giving a little bit of an overview of the Affordable Care Act. And the goals of the Affordable Care Act are to expand health insurance coverage. When the Affordable Care Act was first implemented in 2010, we had upwards of 50 million Americans without health insurance, and that number was just growing and growing, and it was presenting a real crisis for people. So the goal was to expand health insurance coverage, improve coverage for those who did already have health insurance, and improve access to and quality of care, and control rising health care costs. Those were the goals. Health reform, or the Affordable Care Act, has actually been implemented in stages. The very first stage was in 2010, and some of you might remember this. That was when insurance companies were required, if they provided dependent coverage, to allow coverage until age 26. for adult children, regardless of marital status or if they were in school or not. And then it got rid of some of the things that insurance companies used to be able to do, which is they used to be able to place lifetime caps. They used to be able to rescind coverage of people. And I've been around a long time doing this work, 21 years, and I actually worked, at Healthcare Consumers before the Affordable Care Act. And a lot of the clients that we had were people who were actually going through these problems. People who had health insurance, they thought that they were covered, and then maybe they got a diagnosis of cancer, and they started getting treatment. And 3 months into the treatment, they were sent mail from their insurance company that included a check paying them back for the last 3 months of premiums and saying, we're no longer covering you, good luck. And now these individuals had pre-existing conditions, and it was very hard for them to get covered. And those were the kinds of situations we used to work with. The pre-existing condition, it changed so that people could be covered even with pre-existing conditions, and required that children cannot be denied based on pre-existing conditions, and a couple of other things. And then between 2011 and 2013, there were new things that were put in also. For example, no cost sharing for preventive services in Medicaid and Medicare. And that also applies to other insurance, and it applies to all insurance going forward. If you are going to get a preventive service because it's scheduled, it's an annual mammogram or colonoscopy or something like that, you're not supposed to be charged a copay. And the idea behind that is that we really wanted to encourage people to start getting preventive care, especially people who had been out in the cold and not getting that care because they couldn't afford it. And then the thing that's changing now, navigators, people who do this sort of work that we do, but we're federally funded, that got started. Now under the Trump administration, that funding is being slashed. We're able to do this work because we don't get that kind of grant funding. We're community supported, so that's why we can do this work. Now, 2014 was that's when a lot of people think the ACA really started, but that's just because that's when Medicaid could be expanded, and the state of Illinois did expand Medicaid, fortunately for us, and the health insurance marketplaces went live, and people could start getting insurance through the marketplaces. They could also get premium subsidies, which are financial assistance, and then the insurance market rules changed, and this isn't just for marketplace plans, this is across the board. There were prohibitions on denying coverage or charging more for those who are sick. Standards or benefits were standardized, so now even if you don't get your health insurance through the marketplace, you can still count on your health insurance covering certain services. That didn't used to be standard. And back in the day, before 2014 and before 2010, we would also see situations where people would think they were covered. A woman would find out that she was pregnant, and she wanted to get prenatal care, and then she would find out that prenatal care was excluded from her health insurance coverage because there was the fine print. That's gone now. So even if you don't get your health insurance through the marketplace, we've all benefited from the Affordable Care Act and these changes. Okay. So we've talked about some of the benefits and then some of the protections. And one of the things these are all really important, but one of the things that's really important that we'll talk about a little bit later, you may have been hearing about short-term plans now. This is a new thing, short-term plans. Short-term plans really don't have these kinds of protections, so they're not the same. That's apples and oranges. Okay. So how did the Affordable Care Act make health insurance more affordable? Basically in 3 ways. The first is in providing financial assistance in the form of advanced premium tax credits for those with incomes between 139% and 400% of the federal poverty level. And Adani will talk about that much more. But basically what that means is, based on your income, if you qualify for this kind of support when you're shopping for a plan on the marketplace, your monthly premium will be reduced because you'll be getting financial assistance. Providing out-of-pocket cost sharing to those, so insurance companies still have to do that. Well, Adani will talk about that, but it helps make insurance more affordable to people. The Trump administration is changing how they deal with insurance companies on that. But one of the biggest ways was expanding Medicaid. And the state of Illinois chose to expand Medicaid, and we're very glad for that. The expanded Medicaid changes Medicaid. Now, people who are at 138% of the federal poverty level or below can qualify for Medicaid. In the past, before the Affordable Care Act, the only way you could qualify for Medicaid is if you met income criteria and also some category. And the category could be you were a pregnant woman, you were a child, you were a low-income senior, person with a disability, or something like that. You had to meet both income criteria and some categorical criteria. And that's why, for example, waiters and waitresses who don't make that much money couldn't get Medicaid. Well, now, under the expanded Medicaid, they can. So those are the ways that health insurance has been made more affordable. Okay, and now to really get into the details, Adani Sanchez is going to talk to you and take you through all of that. Thank you.
Good evening, everyone. Thanks for being here. I'm going to be talking a little bit more about the health insurance marketplace. It's also known as healthcare.gov, Obamacare, the marketplace. It's got a whole bunch of names, but people just sometimes also refer it just as ACA. I know that sometimes I'll do that, like the ACA. But this is we're talking about a very specific place. It's an online marketplace at healthcare.gov. And there is only one health insurance marketplace. There isn't like healthcare.gov or healthcare.com. That is not it. There are a lot of different places that people are buying up so that they can spam people and also collect information about different people. So there's only one healthcare.gov, there's one health insurance marketplace, and it's at healthcare.gov. What you need to know about the marketplace: there are new affordable options available for people without insurance. All these plans, just as Claudia was talking about, have to cover certain benefits. So all the plans that are on the marketplace are qualified health plans that are required to cover a set list of things, and you'll know exactly what those are. We'll cover those in just a moment. Financial help is available so that you can find something that is affordable. And then all health insurance plans have to show you what their costs are in simple language with no fine print, no weird things. So that's, again, standardizing the way that health insurance is conveying information to consumers. In Illinois, the health insurance marketplace is called Get Covered Illinois, but we still go to healthcare.gov. That's where they can go to find out if they're eligible for private health insurance plans or Medicaid. We have a partnership here in Illinois where they work together. So healthcare.gov works together with the state of Illinois, and they work to get the word out about the health insurance marketplace. People can enroll online at healthcare.gov, but they can also enroll over the phone at 800-318-2596. Or you can also get a paper version mailed to you, and you can mail it back. Open enrollment for the health insurance marketplace is November 1st through December 15th. This is very important because this is a much shorter enrollment period that we've had. So last year was the first year when they shortened our enrollment period. Again, this is part of the administration's kind of sabotage efforts to make it harder for people to get health insurance. So we encourage everyone to spread the word that the open enrollment period is much shorter this year. So please get the word. It used to be like many months long, and now it's only a month and a half. For health insurance to start January 1st, you do have to choose a plan by December 15th. So these are for plans. Even if you chose a plan on November 1st, it wouldn't start until January 1st. People will find out if they're eligible for tax credits, Medicaid, or cost sharing reductions through one application. So it's a one-stop shop, and you can get a whole bunch of information from just going to that one place. If you lose your health insurance or need to find health insurance sometime outside of December 15th, these are some of the reasons that you would be able to get onto healthcare.gov after the open enrollment period is over. So things that are considered life changes. So losing your insurance from a job or from your parents, if you're no longer eligible for healthcare coverage through their jobs. that would be a special enrollment period. Having a baby, moving to a new zip code, changes in a tax household, that means if you've lost a dependent, if you got married, if you got divorced, if you had another tax dependent, that's what a change in a tax household is. Turning 26 and losing dependent coverage, and then a couple of other things. So if you're within 60 days of one of these events, then you would be able to go onto healthcare.gov and find a plan. And that's 60 days before the event or 60 days after the event. So as long as it's within a 60-day window of that event. The marketplace is for people who don't have health insurance, who are uninsured, people who have an individual health insurance plan that is not from an employer, people who purchase dependent coverage, people with COBRA health insurance. Again, COBRA is if you are employed, your employment ends, and then you have the option to continue your health insurance without your employer helping you pay for that health insurance. So COBRA, again, would be, if you have that, you would be able to get onto healthcare.gov. Even though it's technically, that's the health insurance you were getting through your employer, now your employer isn't helping you pay for it. And then people who are self-employed with no employees, so one self-employed person. Families, small businesses, and then people who are offered health insurance, possibly through a job, but it's considered unaffordable. And so they have a standard for that, and that's 9.5% of annual income, of household income. You must be a U.S. citizen, visa holder, or permanent resident. There are some other qualifications for immigrants that you can still get into the marketplace, but you do have to have some sort of documentation, and DACA actually does not count. So who cannot shop in the marketplace? People who already have health insurance, people with Medicare, Medicaid, individuals who are currently incarcerated, and then those who are undocumented. And earlier I talked about the set benefits, and those are called the 10 essential health benefits, and that's what all marketplace plans have to cover. That means emergency services, maternity, prescription coverage, ambulatory services, lab services, preventive services, pediatric services. So these are the things that all health insurance plans and then certain qualified health plans have to cover. So a little note about dental coverage in the marketplace. That was actually not included as an essential health plan for adults, an essential health benefit for adults. It is an essential health benefit for children though, so that is required for marketplace plans, is for them to have pediatric dental care. Dental insurance is treated differently, unfortunately. On the marketplace, you can find dental insurance though, but they don't have an extra separate subsidy for that. You're just going to be paying for that plan separately. There are different levels of coverage on the marketplace plan. These are catastrophic, bronze, silver, gold, and platinum. In Champaign County, we only go up to gold. We haven't had any platinum plans, and I don't expect us to this year either. What this means, this is referring to the actuarial value. So an insurance phrase is actuarial value. So this kind of means how much of the total cost of medical services that plan is designed to pay for. So what will happen is that these bronze plans, they will be the cheapest plans, but they also help you pay for stuff. They help less when it comes to actually paying for stuff at the doctors. So that's the way to think about these things. It's not a flat percentage of like every benefit we're going to pay 60% on. It's kind of an average of what total medical costs will be.
So when you say they're the cheapest, you mean the premiums?
The premium, correct. So this isn't necessarily a qualitative. It's not like gold is the best and bronze is the worst. It just means that, bronze plans are going to be the cheapest premium, and they're going to help you the least when you actually go to the doctor because you're paying a cheaper premium. The benefits between the levels will be the same, but the cost sharing is what's different. And so part of the glossary explains what it means, what cost sharing is. So that's copay. So that's, again, cost sharing is what you pay at the doctor's office. So deductibles, copays, coinsurance, these are the things that are different between all the different levels. The lower level the plan, the lower the monthly premiums, but the higher your out-of-pocket costs will be. All the plans have a maximum out-of-pocket limit. So that means they have a ceiling for how much your out-of-pocket costs will be. All levels will have to cover all 10 essential health benefits, but they cover them in different ways. Catastrophic health plans are available to people under 30. 30 and over who've received a hardship exemption can be eligible for these, but you'd have to submit additional paperwork. In the marketplace, catastrophic policies cover 3 primary care visits for free, and they cover free preventive visits. If you buy a catastrophic plan in the marketplace, you cannot get financial assistance based on income. In Champaign County, we don't have the 2019 information just yet, but in 2018, we had 2 insurers offering plans, and we had about 26 different plans. Oh, it just came out. Okay, Carol's going to talk about the stuff that's available.
Like today.
And so a majority of those plans are going to be bronze and silver plans. And again, insurance was made affordable in 3 different ways: tax credits, out-of-pocket cost sharing, and then expanded Medicaid. And so you'd be able to apply for all of these things through healthcare.gov. The tax credit is a refundable credit that helps reduce premiums for health insurance purchased through the health insurance marketplace. About 80% of people buying from the marketplace qualify for a tax credit. So again, maybe you've looked at it in the past, maybe you never put in your income and realized it was really expensive, but again, putting in your income and checking healthcare.gov to see if you might be eligible for a subsidy is well worth the time, especially if you might be eligible. A tax credit can be taken in advance and paid to the health insurance company to reduce your premium, or at the end of the year in a lump sum. But a lot of people really like having a cheaper premium instead of waiting until they do their taxes to get a lump sum. So a lot of people prefer to take the premium in advance, which is totally okay, and it happens very regularly. It changes every year, so maybe last year your income maybe didn't qualify for very much financial assistance, but it's worth it to check every year because it does change with the federal poverty level, which goes up every year. It can only be received through healthcare.gov, so you can't go off of the marketplace and try to find financial assistance on plans that are not offered on the marketplace. Cost sharing reduction. So we talked about cost sharing earlier, so things like co-pays, deductibles, co-insurance. To be eligible for a cost sharing reduction discount, that's going to be for a certain income level up to 250% of the federal poverty level. And so that means that your deductibles, co-pays, and co-insurance are going to be a little bit cheaper. Cost sharing reduction is a discount on those things that we just talked about, and it specifically applies to silver plans. And so you can see here some of the income information. So for one person making up to about $16,753, that person might be eligible for Medicaid. So we can always help people. Again, healthcare.gov is going to be your one-stop shop, so that if you don't know if you qualify for Medicaid, you can always go to healthcare.gov. There's no wrong door. We like to tell people, because we know you can also go to an online, to the state of Illinois, aid.illinois.gov website to apply for Medicaid. But again, that's only if you know, and if you don't know, you can definitely go to healthcare.gov. What counts as income? So wages, net income from any self-employment, unemployment compensation, and yes, even Social Security benefits and disability payments. Alimony, retirement income, things like child support don't count. Gifts or supplemental security income, veterans disability payments, workers' compensation, and proceeds from loans, those things are not considered income. And again, Healthcare Consumers is here to help figure out if you have questions about what kind of income counts as income, you can always come by our office or give us a call. Expanded Medicaid is actually we're very excited about it. Claudia and I both come from Texas, which is a huge state with one of the highest uninsured rates. They did not expand Medicaid, and this has become a very big problem for them. Now that we have had a whole bunch of hurricanes come through, this is going to be a big problem too for people who maybe have lost their jobs, they've lost a whole bunch of things. Expanding Medicaid was actually like a really great thing that Illinois did. And it is, and we're still pushing. We'll talk about that a little bit later. People are still pushing to try to get Medicaid expanded in different states. Medicaid is health insurance that's offered by the government. It's also known as the medical card or public aid. It covers the 10 essential health benefits, just like the private plans offered in the marketplace. Expanded Medicaid for adults has no premiums, so that is a free monthly plan. There is some cost sharing involved in some of the plans, but it's very low cost. It was expanded in 2014, and the income limit went up slightly, and the categorical requirements were removed, as Claudia explained earlier. Medicaid for adults, like the ACA category, will not be looking at assets, just the types of incomes that we mentioned earlier for individuals under 65. It gets a little bit different once you're over 65 or if you meet a categorical requirement. The Illinois Medicaid application can again be found at abe.illinois.gov. And I did want to take a little moment to just talk about how Illinois Medicaid is changing a little bit. So this year they were moved into specific plans. So these are private plans that have contracts with the state to manage Medicaid benefits. So that's called Health Choice Illinois or Managed Care. There will be 4 plans available in 2019. And so they vary a little bit. So a lot of them have reduced co-pays for doctor visits. They provide transportation not only to doctors' offices, but also to pharmacies. So sometimes they can offer a couple of extra benefits beyond what the regular medical card covers. Getting ready to enroll. And so now we will hear from my coworker, Chris Garcia. Thank you very much.
Yeah. Can you guys hear me, or should I use the mic? Good? Okay. I'll go for it. All right, so this is going to be just kind of some tips on how to get prepared for signing up, since we're getting close to that first day. So the first thing is gathering your information, your documents. The marketplace does usually require some kind of proof that you're going to be eligible, especially if you're applying for the tax credits. So that will be social security numbers, state IDs. If you're an immigrant, you would need the passport stamp or something that shows your status, and then obviously income. So pay stubs. You can also use the previous year's taxes. If you're self-employed, that requires other documentation, your Schedule C's and all of that stuff. So we can help out figure out what of all that you will need for that. If you have a preference as to where you get care, if it's Carl, if it's OSF now, or if it's Christie, having a list of your primary care, specialty care, prescriptions, all of that stuff, because we want to make sure that the plan that you're choosing is actually going to be useful. So the formularies change, and there's a prescription that used to be tier 1 and might get switched to tier 2, or if it's now preferred or name brand, we want to make sure that you know those costs up front, so you know what you can budget for your health care. And then again, we push Medicaid really hard just because that's a big population for folks that don't know that they qualify, so we help them get into Medicaid and get those benefits. Some more tips. So we did add a glossary in your packet. This is just kind of the most basic thing. So when you're shopping, that's the main display for every plan. So it'll show you the premium, which is what the monthly cost is, just to have the actual plan. The cost sharing is what determines what your co-payments are going to be, or the co-insurance, or the deductible. So as Adani said, for those silver plans that have that cost sharing, it might be different from a bronze plan. If you're choosing the silver one, there's extra incentives for that. The advanced premium tax credit is the subsidy that you get to make the monthly payment affordable. There's a few ways you can use that. It's in advance because you can use it up front to lower the price to the lowest amount possible. But you can also use a portion of it. You can designate how much of that you want to use. I don't think I've ever come across anyone who decides to not use any of the tax credit. But for example, if you're self-employed and you don't know your income right off the bat, you might consider maybe not using the full amount and having some reserve in case. Because at the end of the year, it all gets compared to what you estimated, what you actually earned in your taxes, and then all of that gets kind of recalculated, and best case scenario, you made exactly what you estimated. You get a lump sum, you get your return, But in some cases, you might have overestimated your income, and then you might have to pay a portion of that back. So that's how that tax credit works. Your deductible is it's a set dollar figure that has to be matched before kind of the plan kicks into full effect. So you do get the basic care, so which would be your primary, your specialty care, your prescriptions for the most part. But some of the lab work, diagnostics, some of those things are attached to the deductible. So it might say you have to meet the deductible before you can get this covered at 60%, 80%, or at full cost. So you wouldn't pay anything for that out of pocket anymore. The out of pocket maximum is a cap on the amount of money that individuals are required to pay. So for example, if you were to have an accident and your emergency care is X amount, you meet your deductible and you meet your out of pocket maximum. Hopefully it doesn't happen, but if you were to have another accident, then it would say you've met your out of pocket maximum. So now this benefit is 100%. So you don't pay anything out of pocket for that. Things that don't apply to that out-of-pocket maximum, though, would be like your primary care, your specialty care. Because for the most part, those would be set dollar amounts that are already established in the plan. Again, just another reminder how to apply. Healthcare.gov is a one-stop shop, so it will direct you to Medicaid if it says that your eligibility determination puts you in that category. Otherwise, if you know already that you qualify for Medicaid, aid.illinois.gov is a direct way to apply with the state. And if you're unsure of what you qualify for, there are some tools that you can use before you complete an application. And you can obviously also call us, and then we can do either in-person appointment or email or just over the phone to come answer any questions. If you use the phone number, it's that 1-800 number. And I think to request a paper application, you go to healthcare.gov, and I think you can either call to request one or online select for them to mail you or print one out from their website. Another reminder, open enrollment is November 1st, and that applies for plans starting January 1st. We are the local agency, I think, for the most part, so I'd say contact us. These are steps if you're going to renew your coverage. So we go to a lot of tabling events and a lot of people are just kind of comfortable with what they have. It's always a good idea to shop and see what next year brings. Review your plan, see if anything's changing with the formulary or with the doctors, providers. You want to make sure to update the income because you might be eligible for more tax credits. As Adani and Claudia said, the income brackets, the federal poverty level changes every year. So if that happens to make a difference in your application, then you might be eligible for a higher tax credit. Might be some plans changing. Sometimes they discontinue some options. Usually you get a notice from either the insurance company or the marketplace letting you know of that change. So they would say, this is no longer going to be offered, but here's another plan that's pretty similar to what you had. You can either get moved into that one, or you can just shop between all the other options and see if there's something that fits your need better. Appealing a decision. So if you're not content with what the eligibility result was, there is a way to appeal that. So you would have to file a paper form, or I believe you can do it over the phone as well. We do an in-person assistance. If you have questions about appealing, we can submit that form for you, mail it in, get all the documents that you will need to see, maybe the tax credits weren't as much as you thought you were expecting to get. So we can see what changes you might be eligible for. Another big one is exemptions from the individual responsibility payment. So this is a new change that's happening for 2019. For 2018, that penalty still applies. So if you went more than 2 months without coverage in calendar year 2018, you will be penalized, and you will have to that usually just gets taken out of your taxes automatically. However, that is changing for next calendar year. So they're not going to enforce the penalty starting 2019. Not sure how that's going to look yet, but for this year, that's the big point. For this year, it does still apply. So it'll be either $695 per adult, $347.50 per child under the age of 18, for a maximum of $2,085 or 2.5 of your income, whichever is higher. The exemptions, we can also help out with your exemption if you think you qualify for one. I'm not going to go through all of them because there's a lot of different ones. But some of the main ones that come up are if you're a part of a religion that opposes having an insurance policy, if you're undocumented, if you're incarcerated, or if you were incarcerated for a large portion of the year. If your income is below the threshold for filing taxes, if you have to pay more than 8.05 of your income towards health insurance, it's considered unaffordable and you can apply for an exemption from the penalty for that reason. There's two ways to file. You can file an exemption directly with the IRS, or you can file one with the marketplace. Sometimes you can do when it's tax season, others you want to do ahead of time. So we can go over which ones are more timely and you want to do those ahead of time. And then like I said, the 2-month gap does still apply for this year. For 2019, the penalty will not apply, or it won't be enforced.
Technically, it will be $0.
Yeah, it won't be enforced. It's a $0 penalty. Hardship exemptions are some of the most common ones that we see. So if you're facing an eviction, or if you're being evicted within the past 6 months, if you are homeless, if you receive a shut-off notice from a utility company, if you experience domestic violence, filed for bankruptcy within the past 6 months, had a medical expense in the last 12 months resulting in substantial debt, those are our exemptions that would waive this full year. So if you see that one of those applies to you, we can do an exemption for that for this year. So like I said, there's a big list on healthcare.gov. You can search for yourself, or you can call us and we can see, figure out which one applies, and we have those forms ready to go. We can help you fill it out, get the documents ready, and I will hand it down to Carol.
Thank you. There we go. Is there a clicker, or which side is it?
Oh,
Is it
sorry.
yeah,
Yeah, you can use the arrows. You can use the down arrow or the cross arrow.
Perfect. Good evening. Thank you so much for having me. My name is Carol West. I am with the Illinois Department of Insurance. And as Adani and Chris and Claudia all shared, they are the trusted experts in this area. So every year I do reach out to them and see if they're having a conversation about healthcare in Illinois. And so I'm so glad that they welcomed me here. I am going to talk about something a little bit different. The Affordable Care Act is something that was very important in the mental health and substance use disorder conversation, because it made it mandatory for carriers as a part of the 10 essential health benefits that Adani mentioned earlier. Insurance carriers now had to cover mental health and substance use disorder treatment. It had to be a part of their benefit package of what they offered. So we're going to talk a little bit about that. We're going to kind of skip over a little bit about what the Department of Insurance does. Our mission basically, we'll just do it super basic, it is to stabilize the health insurance marketplace, trying to bring costs down. That actually happened this year. We are seeing a 0 to 5% decrease in many countries across the state, and nothing more than a 5% increase. So it really stabilized this year. A lot of things have come into play with that. We actually have a new carrier in the area. It's going to be up in northern Illinois. As Adani shared earlier, there are 2 carriers in Champaign County, and it is Health Alliance and Blue Cross. There are 10 to 26 plans with those 2 carriers. That just came out on the 10th. So that's why you didn't see it. And you can see that there's a full plan analysis on Illinois, the Department of Insurance webpage. It's down in the recently released news. So the program that I am giving is called the Access to Coverage and Treatment. And the conversation is around mental health and substance use disorder parity. Parity, we're going to talk about that specifically in just a moment, give you that definition. But the reason that we're doing this is that since 2016, 1,900 Illinoisans have died because of overdoses. And that number has increased because those are actually the 2016 numbers. So that was from 2008 to 2016. So the governor did a state of Illinois opioid action plan. And part of that plan, doctors, insurance carriers, stakeholders, we all came together and started talking about how can we change this. The Department of Corrections was a part of the conversation. The police department, fire, first responders were all a part of the conversation. So in Illinois, we were the first state, the only state in the United States to change our benchmark plan. So that is how we stepped into the conversation. By changing that benchmark plan, it is opening up more treatment. We are limiting opioid for acute pain. We're removing barriers to alternate treatments. So back in the day, to have an insurance company pay for a chiropractor was just unheard of. They just wouldn't do it. So now these alternate pain options, way to minimize pain, that are outside of the just give you a script for an opiate is becoming more acceptable and required for these carriers to cover. It also, the new benchmark plan, and I'm going to explain what a benchmark plan is in just a second, but it requires that the insurance carrier cover a prescription for the intranasal Narcan whenever anybody is prescribed an opiate over 50 milligrams. So for someone who may be potentially get addicted to this or may accidentally overdose, it's required that they cover this Narcan along with the opiate. And there's an increased coverage for telepsychiatry. So trying to expand that provider network, especially in the rural areas, what you see is there's just not enough doctors available. So now we are expanding this telepsychiatry as a part of this new benchmark plan. So a benchmark plan is a basic set of things that insurance carriers must cover as a part of, when Adani was speaking earlier, she talked about the silver plan. So we base everything off of a silver plan. So this is what all insurance carriers will need to build their insurance plans off of. And Illinois, like I said, in August, this was announced, we were the only one in the nation to request this change. So parity. What is it and why is it important? So parity means balance. It means that your insurance carrier must cover your mental health and substance use disorder treatment items the same as your medical surgical. Now it gets a little tricky The ones that are super easy to understand are the quantitative treatments. So what I mean by that is, can I count it? And those are super easy. The non-quantitative are the ones where it's not something that you can easily identify, and we're going to talk a little bit more about those in just a moment. So parity, if you just think balance. These are the items that must be parity. They must be in parity. So the easy ones are your quantitative, your copays, your deductibles, your maximum out-of-pockets. But then when you get into your inpatient, outpatient, intensive outpatient, hospitalizations, residential treatment, that's where it gets a little more difficult for the Department of Insurance to identify if things are going equally. Because is an insurance company asking for more paperwork for an inpatient stay on mental health and substance use disorder side than they are for medical and surgical? Now, for this particular slide right here, I have brought a whole bunch of these. These are we call them palm cards, and all of this information is in the palm card. So how to identify if your rights are being violated are all in here. And then on the other side, it's very handy-dandy where you can put your doctor's name, your urgent care center, your hospitalization, how to contact your insurance company, and it all folds up and you just tuck it in your purse and pocket and wallet and you're good to go. So those are back there. So don't feel you have to write really quickly. So the best way to talk about parity is to talk about how it was before. Like Claudia talked about what it was like before the ACA. So we're going to talk about what it was like before parity. So before, I actually worked for an insurance company and I would get the phone calls. This was early 90s, and you would have a different deductible for your mental health than you would for your medical surgical. So people would have to meet this deductible and this deductible before anything kicked in for their mental health and substance use. And most of them didn't cover substance use at all. So it was just that mental health piece, and you had this massive deductible that you had to reach before you could get to any services. They would also have a higher copay for your psychiatrist or counselor than they would for your orthopedist. So you could break your leg and pay $50 to go to the specialist, but if you wanted to talk to your psychiatrist or your counselor, it would be a higher copay. Then in 1996, the Mental Health Parity Act kicked in. So that's when things really started happening to stabilize what we did and destigmatize in a small way how we treat mental health and substance use disorder parity with medical and surgical. In 2008, that's when the addiction piece came into play. So we still held addiction separately than mental health. But in 2008, we brought addiction into it. 2010, for me, I think was one of those landmark things that came into play for this, because now insurance carriers, we can talk parity all you want, but if a carrier is not forced to cover it, then there can be no parity. So the Affordable Care Act kicked in that 10 essential benefit piece, and honestly, it's one of the most important things that we need to protect, is that 10 essential benefits. And the pre-existing condition, because both of them are really fundamental for getting treatment with mental health and substance use disorders. So then a couple different things have happened since then. In 2015, Illinois had House Bill 1, which is where the Narcan and having Narcan and the ambulance drivers and pharmacists could prescribe it or could give it out to family members, and all of the training that came around Narcan to help people reverse overdoses really came into play in 2015 with the House Bill 1. Okay, so now, since parity has been implemented, you have one deductible that covers both, and your co-pays must be equal. So those are your quantitative. So those are the ones that we can easily find. So in your little list, it has these in there, but some of the ways that you can find out if your rights have been violated, is something different? Are you being required to pay more for services on your mental health and substance use disorder side than you are your medical and surgical? This is the hard one for us. Are you being asked for more paperwork? If your insurance carrier covers or if they say, okay, for a heart problem, they just across the board, they approve 7 days in the hospital, and that's fine. But you go in for something that's mental health or substance use disorder related, and all of a sudden, day 2, they're like, hey, where's that medical necessity? We really need your documentation. Give us paperwork, give us paperwork, give us paperwork. This is really hard for us because if there isn't adequate documentation for medical necessity, those are the kind of things that are quietly, consumers are having to fight harder to get their care. And unless we know about it on the Department of Insurance side, we cannot hold those carriers accountable. So are your benefits being denied? And are there facilities available to you? So this is a hard one too. The telepsychiatry is going to help a little, and there's some things that we are doing with the department to try to make sure that the carriers are held accountable to making sure that there's facilities that are available. Okay, so what to do if your rights have been violated. They're very basic things. Call your insurance companies, ask questions, but what I basically say is engage the Department of Insurance. Engage us, engage us, engage us. If we don't know, we can't change it. So unless we get these complaints, we don't know what carrier is violating your rights. So the way to engage us, 2 things. So the office, and this is also back in our paperwork, the Office of Consumer Health Insurance Hotline, they are the parity specialists. So they are the ones, this was specifically made for people that may be having problems with their insurance carrier related to their mental health and substance use disorder treatment plan. And then external review. So if you request, or if you are seeking services and the insurance company say, nope, not going to do it, you can request a review internally. So to the insurance company, you're saying, no, this is the path we're going to take. And the insurance company has to review that internally and come back with an answer. When they come back with that answer, if the answer is still no, then you, by law, by statute, have the right to an external review. With that, you engage the Department of Insurance. The letter that the insurance company sends to you has this all spelled out. They have to say you have the right to an external review. And once you get that, you would engage the Department of Insurance. Now, that all seems well and good, but how long is that going to take? So the easy way, if it's an emergent situation, it actually can take 3 days. So the standard procedure, let's say you have a claim denied and it's not like super critical that it get taken care of, it's 21 days. But for something that is urgent of nature, need care right now, it can take up to 3 days. That's the deadline is 3 days, but it can be turned around quicker than that based on what the urgent necessity is. Whoops. This is not out yet. I do not have this yet, but I will be distributing them across the state. This is basically what I'm telling you in a book. And we're going to be distributing those. It tells you your rights. It gives you a log of every time you've called the insurance company. It has a 3-page document on how you can work with you can advocate for yourself with your providers as far as medical necessity. So the Department of Insurance covers 20% of the marketplace, and I won't get into great big detail about that, but what we have regulatory authority over is very small. So I've included these, the Medicaid number for assistance, Medicare, and the U.S. Department of Labor. If you have any of those plans, look for their hotline number or their number about relating to parity. This is how you find us. I am with Get Covered Illinois, the official health insurance marketplace. And how you would find assistance, in-person assistance, is by making an appointment right there through our webpage.
Could you go back 2 slides? I'd like to get that phone number.
Which one, Medicare?
Yeah.
1-800-633-4227. Anybody want Medicaid?
I like the top one, 843-6154.
Anybody need the Department of Labor? You have an employer plan, possibly, self-insured? Okay.
Does one of your handouts have all those numbers?
They do not have all of those numbers, but they do have our number, and we can get you that number. So in 7 o'clock, interest of time? Okay, so for the interest of time, this is just a review slide. I'm just going to talk about one more thing, and that's premiums. The reason that I want to talk about premiums is that in Illinois, we saw from December 15th to February over a $20,000 drop, or 20,000 member drop off in enrollment from when they engaged with the marketplace to when they stopped and they didn't pay their premium. The reason that this is important is if you are in crisis, if you do need mental health and substance use disorder benefits, without health insurance, it's going to be an extreme financial burden. So effectuating coverage, meaning paying your premium, is really, really important. We have seen people that just accidentally forgot to pay August, but paid September and October, and then got canceled in November, all the way back to August, and they had treatment during that period of time. So now they're 4 months without coverage because they've been covered all the way back to August. They're subject to a penalty, and their bills aren't going to be covered. So please encourage everybody, pay your premium, pay your premium, pay your premium, because it is incredibly important. Okay, this is how you find us. We've given the numbers, and I do have the information in the back, and that is it for me.
Great,
Thank you.
Thank you very much. Okay.
Can I jump really fast off of what Carol was just talking about?
Come up here while I do this.
So, Carol was talking about paying your premium. Sometimes you can't pay your premium. Sometimes something happens and there's just no way you can pay your premium. Healthcare.gov, Medicaid allow for changes at any time. Or if you have any questions, you can come talk to us and ask, hey, is this something that I need to report? Is this not something that I need to update? Because changes in income, losing a job, gaining a job, any of those changes, those could affect, we could update your income and make your premium cheaper. Maybe you're eligible for a bigger tax subsidy now because maybe you lost your job or someone in your household lost their job. So if something like that does come up where now it's becoming really hard for you to pay your premium at some point, maybe we need to ask you a couple of questions and see if we need to update information. And that's something that I don't know if we made totally clear in our presentation, but yeah, so if any changes come up, even if it's not a special enrollment, if any big changes like that happen, give us a call, or if you have any questions about that, because we definitely don't want you to lose your health insurance because of premium payment, when there might be a way that we can kind of help that.
Why don't you stay up here?
Okay.
We're going to just take a few minutes to talk about the Affordable Care Act going forward, because there's a lot of stuff in the news. And then we'll get into some Q&A. But there are some threats to the Affordable Care Act, but what you need to know is right now it is the law of the land. Despite all of these, there's no reason to not go and sign up.
Please sign up.
Please sign up. But one thing to know is that some of you may have followed this, but obviously we have an open enrollment period coming up. It's November 1 to December 15th. That's 45 days. This is the second year in a row that the enrollment period has been slashed in half. So now it's 45 days as opposed to 90 days, which is what it used to be. But it's not actually even 45 days. That's just the, the time frame, because healthcare.gov, again for the second year in a row, will be shut down every Sunday for maintenance. So then that makes your 45 days to get signed up into 36 days. So don't delay. The other thing just to mention is that there is a case out of our home state, Texas, we're sorry, that could pose a real challenge to the Affordable Care Act. Right now, the speculation is that no matter whichever way it's resolved, it'll probably end up going to the Supreme Court. Now, obviously, this will take time. It doesn't affect the upcoming open enrollment period, fortunately. Another development is that there are these short-term insurance plans, and we just want consumers to beware. A lot of people may be drawn to the short-term plans. The Trump administration has changed short-term plans to allow now that people can have these for up to 3 years. What you need to know is that you cannot get subsidies for these. They do not have to have all the benefits and the protections that we discussed. In my opinion, they are not real health insurance. Real health insurance is not an umbrella that melts when you get out in the rain. These short-term plans could be like umbrellas that get out in the rain. We're concerned that a lot of people might be drawn to them because they may seem more affordable, but you never know when an illness might strike or you get a cancer diagnosis or something like that. And so, there's a lot of hype around these, but, we don't necessarily think these are a good bargain.
And they can be canceled at any time at will of the carrier.
Yes.
So they are not bound to pre-existing condition. They are not bound to the other rules that marketplace plans are bound to. There will be a document on the Department of Insurance webpage. It's in legal right now. Please take a look at it. It just sort of compares what the coverage is to an employer plan or a marketplace plan, and then the short-term plans.
And if it gets canceled, you don't get a special enrollment
Correct.
period in the marketplace. So
because
just,
it wasn't considered credible coverage.
yeah. There are some threats to Medicaid. As Adani said, we love the fact that the state of Illinois expanded Medicaid. There's so many people just in this geographic area right here who work in restaurants, bars, cutting hair, different kinds of jobs like that, who have benefited from Medicaid. There are still some states that have not. Unfortunately, many of the states are states that are or have recently experienced natural disasters. Texas, Florida, the Carolinas, Georgia, all in the news right now. They have not expanded Medicaid. So my heart goes out to the people who, on top of losing their homes and everything, maybe also lost their jobs, lost their health insurance coverage, and have health care needs. That's part of the value of Medicaid. But some states are moving to try to impose work requirements on Medicaid beneficiaries. That would be a whole mess, and we don't think it's necessary.
It's a way to kick people off of Medicaid,
Yeah.
because it imposes more paperwork for people to have to do and then maybe miss and then.
But that's not happening right now in Illinois, so we don't have to worry about that. We're just sort of letting you know what's happening. Then, I don't know what issues
Issues expanding. There are a couple of states that have passed Medicaid expansion and are now trying to kind of build up to do that, and there's resistance. So there are kind of still fights going on, because this is something that really helps people. A lot of these have been voter initiated, so it's clear that people in these states really want expanded Medicaid, and then people who are in power are struggling to actually implement that. So that's what I was talking about.
And then public charge is something you're going to be hearing a lot about coming up. Do you want to give a brief description?
Yeah, so public charge is something that comes up with immigration. When people are considered for changes in their visa status, they are asked if they've ever been a public charge. And so this kind of means if you've ever been a public charge of the state, or if the government has been responsible for a majority of your support being here. The rules for that used to be a certain way where it's like, oh, and only in extreme circumstances could you be considered a public charge. But the administration has now filed a rule to expand that definition of what it means to be a public charge, from everything from getting financial assistance on the marketplace, getting SNAP benefits, getting Medicaid for your children. So not even the person themselves, but getting maybe benefits for their citizen children. That is going to be something that's going to be considered a negative point against them changing their status. So we'll have some information coming out, so please stay tuned. We are going to be encouraging people to file a comment against this, because this is a way that again is going to keep people from applying for benefits that they're perfectly eligible for, that's perfectly legal for them to do, and this is going to keep them away from those things. And specifically with healthcare, this is really dangerous because of public health and the people who are in your community being a direct effect on your health. So in terms of public health, this is a really bad idea, because this means a lot of people are going to be foregoing health insurance and thus not getting care and thus not being healthy. And it's really hurting our neighbors if they can't get things like SNAP and stuff.
So this is a rulemaking process. They're in the process. They've proposed this new rule. There's a public comment period, so we'll be emailing out about that, and hopefully people can weigh in with their comments opposing this public charge. So those are the changes going forward. Just real quick, what you can do to help, and then we're going to just get into questions. But what you can do to help is to help tell other people about the open enrollment period, about Medicaid. Make sure that if you know people who are uninsured right now, and especially if they think they can't afford it, tell them to please come and take a look. Most people are surprised, and a lot of people are thinking about premiums and things like that, and they don't even realize that they actually qualify for Medicaid, which has no monthly premium, and now we actually offer Medicaid managed care plans, you know, Molina and Meridian and others that actually have a lot more benefits that go with them. So you can help spread the word. Right now in this community, you all are about the most informed people about the Affordable Care Act and open enrollment and Medicaid. And so with that, I think we can take questions, and I want to prioritize questions from people who are thinking about signing up, or you're here on behalf of somebody else who needs help. And Adani and Chris can help me answer questions. Yes, sir.
I'm searching into the marketplace and trying to enroll. For when I do find a plan, does it like, is there like a contract, does it ever expire? Do you have to re-enroll next year? Like, how does that work?
Yeah, so the plans are set up as calendar year plans. So the plan that people are on right now ends on December 31st of 2018, and then the plan that you would choose during open enrollment would start January 1st and then go through December 31st. We encourage everyone to review every year, to go back to it and review every year, because you might be eligible for more financial assistance. There might be different plans. Sometimes they renew. Your insurance company would tell you before every open enrollment period whether or not they're going to continue, or if you're going to have to find a different plan, or if maybe the carrier is the same, but they think that maybe if you want, this is a similar plan, but you should always look yourself so that you can make that decision on your own based on the issues that are important to you.
Thank you.
And just additionally, let me comment on that. If the lowest cost silver plan, which is what we base everything else on, if that changes, then that shifts all of the premiums. Mm-hmm. So that changes everything. That's why every year review.
Always come back to it. Always come back to it.
And if you need help, you can, even if you've already figured everything out and you think, you know, this is the one I'm going to go with, but you sort of want to double check with somebody, we're also here for that. We can help take people from the very beginning through the end, or we can just help provide support as somebody is figuring it out for themselves. Whatever people need, we can help with. Other questions from consumers? Okay. Okay.
Is the household income when you're applying based on 2018 or an estimate of 2019?
It will be a prediction for 2019, so specifically on healthcare.gov, they will be asking you to estimate your 2019 income, but sometimes it's going to be the same as 2018, so that's going to be a conversation that like we would have at an appointment. Is your income the same as your 2018 taxes? No? Okay, then let's figure out what's going on now, and we'll predict, we'll try to do an estimate based on what we know.
And if there's a significant change, they'll ask for documentation as to how that happened. So if it fluctuated anywhere higher or lower, be prepared to answer that question. Because you could say, well, my contract is going to end in February, and I know this, so I'm going to be going on unemployment, or I don't know when I'm going to be getting my job, and then just submit that documentation when that happens, and that way it'll validate the reason for your estimation.
And we can also help people with that as well.
Is the documentation needed, previous year's taxes, would that be 2017?
Yeah, so
Okay.
so if you were to come in this year
For
for 2019, that it would be really helpful to have 2018 income, especially if we haven't had that conversation yet. It's always good I always recommend people if they have that just to bring it so that we have like a place to jump off of, because it might not be exactly accurate, but if we can say, well, we don't want to predict way below this if everything is still the same, or maybe if you're self-employed, this is what you made last year, was it a really good year, was it a really bad year, and so that's a place for us to start talking about that. So it is helpful to have those past year's taxes.
And that's the tax return.
Tax return, correct.
Yeah, the main number that matters is the adjusted gross income, which is like the bolded number.
Plus some other things.
Plus some
maybe.
others. So yeah, farming and other incomes, then that's a longer conversation to have. But typically for most households, it's the adjusted gross income. That's the one that you want to have as close an estimate as possible.
If you have a household of, say, 3, but only want insurance for one person,
You would still need everyone's information.
It's always based on the household.
But yeah, you would just select just only one
They're a
person.
tax
needs it.
household.
As long as they're a tax household. So one person is claiming 2 dependents, or 2 people are filing taxes jointly and claiming 1 dependent. So it's based on a household.
Okay.
Not just like roommates.
Right, correct.
Right.
Not roommates.
So like if a spouse has Medicare, then they have minimum essential coverage through Medicare, but they're still in your household if you file jointly, which you have to file jointly.
And you have to count their
Medicare.
whatever income there. So maybe they're receiving Social Security benefits, you'd have to keep.
if they don't want to, I'm assuming the premiums will be based on the number of people who are covered in that household?
Right.
So if you ask for coverage for one person, would that be a lower premium than if the other 2 are added?
Correct, but the financial assistance is based on how many people are in the household and what the income of everyone is. Yeah.
Any other questions? If not, what we can do is we can wrap up, and then if you have questions that you do want to ask, but you didn't want to ask it publicly, you can come up and talk to one of us, and we would be happy to do that. Thank you all so much for being here. Thank you, Carol. Carol drives all over the state.
Yay.
We have lots of refreshments left, so please still help yourself. And we have some handouts at the back, and thank you all very much.
Thank you.